Chair, and members, as I might have alluded in my comments in support of the Roebling amendment, there are some real problems with this approach. The simple fact of the matter is that we have a circumstance out in Minnesota among all of our school districts and our school district employees where we have a number of those school districts who are basically held in a captive market. And for many years now, they haven't been able to really get decent bids out in the marketplace on their health care. And we've heard ample testimony over the last few years about the fact that a number of school districts and their employees are paying just unbelievably exorbitant costs for their health care, the health care that's provided through the service co-ops. In some cases, we have teachers coming to us and telling us that they're actually paying money back to their district in order to pay for their premiums. Others are having to forego it entirely. Others are just taking home a couple of dollars from their paycheck, and thankfully they're married, have a spouse who's bringing income into their household. We've tried for a number of years, of course, to create a larger pool of school district employees, bring them into the PEEP. All told, we've passed those bills in recognition of that fact, but Governor Pawlenty never saw fit to sign those bills into law. But we did learn through that process that if we were able to do that, we're able to save upwards of $80 to $100 million a year. Almost $1 billion we'd be saving for school employees and for school districts across the entire state over the course of 10 years. Significant savings, but I guess $1 billion isn't very much to some people anymore these days. What this bill does, Madam Chair and members, is strips the choice away from employees, gives it exclusively to the employers, that employer-employee negotiation isn't going to happen because the employer has to agree to it. And here's the fact. Those service co-ops have, by law, a majority of their board members, school board employees or school administration. So there's hardly a neutral stance when it comes to having that negotiation, how those decisions are made. What happened as a result of not being able to create that statewide pool is that the school districts, as law allows them, have gone out and sought competitive bids from the PEEP. The PEEP was set up, it parallels and mirrors the CGIP plan that we all enjoy, and frankly has some of the same results in terms of quality, in terms of cost, and that's available to it from pooling, et cetera. And lo and behold, they've gotten highly competitive bids. And that's been a good thing. And what they've done in some instances is they've opted for the PEEP to realize those savings so they could afford their health care and access that quality of coverage. In other cases, it's incented some other competitive bids to come back. Again, a desirable outcome. The bill also allows a withdrawal from the PEEP after only 1 year instead of the 2-year commitment. This has the potential of allowing providers to cherry pick the low-cost groups and leave only the high-cost, uncompetitive districts in the PEEP. I don't know if we want that, Madam Chair. The school employees are the users of the health insurance, and they should continue to have the right to join and withdraw from the PEEP as the majority of their members determine. Most collective bargaining agreements cap the employer contributions. But Madam President, or Madam Chair, I think what is particularly interesting in the Roebling amendment really touched on that, and that is this issue of the fact that these co-ops, even though the employers are paying these premiums, they are participating sometimes to a great degree in paying for the cost of their health care. They're receiving, these school districts are receiving significant reimbursement. Now, I remember when the CGIP plan was run in such an efficient way, and the experience that we had was such that there was extra money left over a few years ago. We as the premium payers got to realize, we got to enjoy some of that savings. That was rolled back into the plan and made available for our use. No one even knew about these dollars. the collective bargaining unit had to do a Freedom of Information Act to even find out. They happened to find out that these reimbursements were being made back to the leadership, back to the school board members who serve as the majority of these boards. This was all kind of happening under the cover of darkness. No one even knew about it. In some cases, in very small districts, tens of thousands of dollars. And what were they doing with that money? We don't even know. But they certainly weren't disclosing it, and they certainly weren't sharing in that savings with those who were paying for their health care. And that's just wrong. So that just points up the inherent flaw in the whole premise of this bill, and the whole premise of taking away this ability for the collective bargaining units to go out and seek competitive bids and really actually trigger the energy of the marketplace so that we can realize cost savings to those employees who are struggling to access health care, even though they're teaching our kids, they're full-time employees, and frankly the resulting savings to our school districts and our taxpayers. So, Madam President, I think this bill is ill-advised. It's clearly being brought by the health insurance companies to wall off competition because suddenly they see folks are getting good information and getting competitive bids. And I think it's just simply the wrong approach.